And joining me right now to talk about staying safe and healthy when you might return to the workplace, nurse practitioner Brandi Giles with Bon Secours St. Francis Health System. She is social distancing here with us at the station. So first, thanks for being with us this afternoon. And of course, you know, a lot of folks will be heading back to work soon. And for people who have not been at their workplace, what advice would you tell folks when they do return to their office?
Don't return if you're feeling bad. Call in. I would hope that managers and supervisors would be more lenient with that type of thing. Make sure that you're staying healthy at home, getting enough sleep and exercise and a healthy diet. Wear your mask where it's required and appropriate, as well as wash your hands frequently and use hand sanitizers and other cleaning products that are made available to you.
And Brandi, up in North Carolina, the governor, they're asking folks to wear masks and or face coverings. So what is your advice on masks? And can you remind us, how they're supposed to be worn properly? Because I think some people might wear them, but they don't really know how to wear them right.
Sure. So a mask should be worn, like I said, when requested or when appropriate. Make sure that it's covering your entire face, so your nose and your mouth. If you have a manufactured mask, there's typically a metal bar at the top that you can press down to cover your nose or to kind of form fit on your nose, as well as making sure that the bottom is tucked underneath your chin so that you can get a full covering and you're not breathing anything outside of the mask.
Brandi, I know one business that will be very busy starting next week as they start to open our gyms. A lot of people, wanting to get back, start to exercise, start to get to where they were before all this happened. A mask might not be the easiest thing to wear while you're on a treadmill or working out. So what would you tell folks heading back to gyms to be able to protect themselves and others around them?
Make sure you're distancing yourself. 8 feet is the optimal, so make sure there's a good imaginary treadmill in between you and other gym goers, making sure that you're not on every piece of cardio equipment, that you're leaving 1 or 2 in between, and making sure you're wiping down before and after, wiping down your equipment, everything that you've touched, everything that you could have possibly breathed on, making sure you're wiping that down and being courteous to your fellow gym goers.
And I know a lot of folks will have to be sending their kids back to daycare as they're heading back to work. Of course, camps, college in the fall, if that actually does happen. What about the kiddos? It's kind of hard to tell a kid, they're not always the cleanest. So how do you protect those kiddos heading back to these camps and, of course, daycare?
So do follow the rules that are set out, that the daycares and the camps are all being guided by the CDC and DHEC as to what regulations they need to put in place to protect our children. So making sure that you're following those rules, not singing your kid when they're sick. The older children, making sure you're just reiterating with them, washing their hands and staying a good distance away from others. It's going to be difficult to play, but that's what's recommended. And I know some daycares will limit the number of kids in the daycare, and following those rules and being patient as we try to ramp this back up.
And Brandi, last question here. I know today Disney, they announced that some of their hotels there inside the park will start taking reservations in July. Not all the theme parks have really come out and said when they might reopen, but we expect that at some point, maybe later this year. What do you want to tell folks, these families who do want to kind of maybe get out and maybe get one vacation in before the fall? How can they kind of protect their families heading out, maybe if they're going on a plane or going to one of these resorts once they open?
Just the general advice of wear a mask, wash your hands, use hand sanitizer. Once you get to the hotel room, even wiping down the hard surfaces in the hotel room is not a bad idea. Outdoor activities are a great way to start getting back involved and out back into the public, because it's easier to distance there. And just, again, be patient and follow the rules and the regulations set forth by the parks and the hotels and the activities that you're doing.
And Brandi, just one last thing. It's really not about traveling or anything like that, but I think with now allergies, that's starting to come back as we warm up. And of course, COVID-19, some of the symptoms might seem similar. What are you telling folks or patients that, it might be allergies, but they don't really know? What are you guys kind of telling folks to give them some guidelines here?
So if you suspect that you are sick, seek care. Virtual visits are available in many different by many different providers and many different formats, and seeking that expert care to help kind of differentiate that, allergy symptoms from what we would consider COVID symptoms. Allergies are going to be, your burning eyes, your runny nose, your sneezing, and you may even have a cough with that, which it's very difficult to differentiate between allergies and the COVID-19 symptoms that they could be having. So seeking care if you're concerned. If you are prone to allergies, do start your over-the-counter medications and do that consistently. So maybe you can reduce those symptoms a little bit and not have that ambiguity or not kind of have to differentiate between the two.
All right, Brandi, thanks so much for stopping by today and spending some time with us. Of course, the nurse practitioner there at Bon Secours St. Francis, and we'll let you get back to work. Thanks so much.
Thank you.